Hello, everyone, and welcome to another day of the second wave of the pandemic, science, and society. Today, we have our first guest speaker of the semester. I'm very excited to introduce you to Dr. Charlene Caburnay. She is a research assistant professor in the Brown School and also the co-director of the Health Communication Research Laboratory at Washington University in St. Louis. Her focus is on designing, developing, and evaluating health communication programs. And she is also part of a collaborative team that recently received funding to develop communication tools surrounding COVID-19 testing and vaccination for students. She has a PhD in behavioral science and health education, and she will be talking about good health communication and risk communication practices, including how to communicate about COVID-19. I know that you all have a lot of questions about this topic, so we'll have plenty of time at the end for those questions. So please join me in welcoming Dr. Caburnay.
Thanks so much, Krista. I'm going to share my screen here. And hello, welcome. I'm hoping most of you are warm inside and not listening to this on the road because the snow is coming down here in St. Louis. As Krista had said, today I'm going to talk about health and risk communication during the COVID-19 pandemic, and bring in some of just general, I'm so sorry, general guidelines for effective health communication. And first off, would like to start with this slide, which is some the survey results from interviews with a nationally representative sample, asking about the biggest concern about getting a COVID-19 vaccine. I think that we can all say, if you're paying attention to any kind of media or communication, that the COVID-19 vaccine is tops on the list of what is being covered on the news. And this sample of about 1,000 adults, sponsored by the Kaiser Family Foundation, has found that a little over 1/3 of respondents are concerned about side effects from the COVID-19 vaccine. So we have, a good chunk of folks concerned about that in terms of the vaccine. And then when we look at those who are concerned with side effects, and we look at demographics, if you see the green bar, that's across all demographics, but then all of those groups that you see above that green bar, Hispanic adults, Black adults, women, Democrats, independents, ages 18 to 49, those are all significant groups. And we need to figure out how we can best communicate with them about COVID-19 vaccine side effects, about the vaccine itself, about any other concerns they might have about COVID-19, and overall, just speaking about health and other health topics. So there is a field called health communication, and this is the study and use of communication strategies to inform and influence individual decisions that enhance health, with the goal of being able to change attitudes, the information environment, and or specific health behaviors in order to create social change. So specifically speaking about COVID-19, I'm going to be referring quite a bit to this tip sheet. It's also generated out of a longer report by Chu et al. From the National Institutes of Health. And this is based on tips for how to communicate regarding COVID-19 vaccination, since that is the present topic on everyone's mind who is thinking about COVID-19. So first, when you're planning for effective health communication, health communication is a study, which means that if you're planning for it, you need to have specific steps and pieces in place so that you can more effectively study it later on and evaluate it. So what we do first is identify the what. So the first part is, what's the problem? And if we think about the vaccine right now, getting everyone vaccinated is the problem, is one problem. You can also think about, what's the problem with COVID-19 testing? It would be trying to get testing, regular testing, available and accessible to all. You can think about what your problem is going to be and identify that, define it, and figure out what are all of the determinants of that problem. How do you do that? Well, it takes a lot of different pieces. So one is to review what's already been published. So look at the background literature, determine what they think are reasons for helping enable that problem or deterring other solutions to that problem. Identifying data, finding data, using data to help explain what the problem might be. The third bullet here is, getting down to basics, communication basics, talking to people, talking to communities. Number one, do they see it as a problem? It is going to be a lot harder, a lot more challenging to try to fix a problem or address a problem if your target audience does not see it as a problem. And this is where collecting both quantitative and qualitative data, or mixed methods, will really help provide a robust set of determinants leading to your problem. And then the last bullet here looks at whether or not there are other problems that might supersede or come before this problem. It's a possibility that certain messages are not getting through because the media channels or the communication channels that they're going through are not being used by the people who we're trying to reach the most. So trying to unpack what the problem is, what are all the pieces that are related to that, is definitely the first step in trying to plan for effective health communication. Additionally, the NIH tip sheet makes this case that the what, what is the what? It's to make COVID-19 vaccination the easy choice. So it's not a difficult step. It's not a difficult behavior to do. Trying to make getting the vaccine an easy choice is what we would like to accomplish with our health communication. Additionally, we want to set out objectives for what we want to accomplish. You might have seen in any of your other classes how to set and identify objectives that are SMART. SMART being an acronym for objectives that are specific, measurable, achievable, relevant, and time-oriented. In doing so, you'll be much better off evaluating your progress on these objectives. So for example, President Biden on January 26th said that he wanted to administer 150 million COVID-19 shots within 100 days, or said another way, 1.5 million vaccine shots each day. So I know that they're counting down how many of those shots he's doing, but it's a very specific and SMART, as in the acronym SMART, objective that he has set out for the vaccine. Second, we want to identify who we're trying to reach. So one of the ways that we do this on a much broader scale is to try to identify audience segments. And in this way, we're better able to tackle um, differing thoughts, attitudes, opinions, and to better reach those segments. So the first step in identifying the audience segments is to know more about them. So because if you don't know much about them, how are you going to know how to reach them or what to reach them with? So you want to learn about their needs, their wants, their motivations, lifestyles, um, and in general, but also specifically to the topic that you're trying to reach them with. So you want to know about their needs, wants, motivations, and lifestyles in general, but then also specific to COVID-19. Thus, you can tailor your messages to these needs, wants, motivations, and lifestyles. And when you do that, the more consistent and customized you are with all of these, the more successful you'll be. And this is based in theory. Those of you who have taken a psychology class before have maybe heard of information processing and persuasion theories, where they suggest that the more relevant information compared to less relevant information will be better processed cognitively and then result in attitude change that lasts and is endures over time. So in terms of audience segments, there's actually been a lot of effort done by the CDC to provide kind of some materials for various audience segments. So here I have a slide, a screenshot of the CDC's website, and they have a section called print resources. And as you can see, there is a section in the drop-down filter where you can filter by audience. So lots of different options here for from the government to first responders, general public members, and then also health departments and healthcare professionals. And based on this filtering, they have provided and developed print resources that are specific for those audiences, or even just appropriate for those audiences. In this slide, also from the CDC website, you can see that you can also filter by topic. So if I choose vaccines, you'll see here that I found 202 total print resources related to the vaccine. And I know that this is really tiny, but if you can see under, for example, this first one, it says audience, and it says all the different audiences that might be, that this particular resource would be appropriate for. If you go to this next one, for example, facts about COVID-19 vaccines, you'll see all the different languages that it has also been translated into. And so, for example, this is one such print resource, and this was designed for educators. So for schools and other educators, the message here is that they're an essential worker, and getting the vaccine adds one more layer of protection. I'm currently working, as Krista had said, currently working on a project with the special school district here in St. Louis, and looking at rates of participation in weekly testing by both faculty and staff at these schools, but then also by the children at these schools. So we've talked about the what, and we've talked about the who, and now we're transitioning to the how. So how do we plan for effective health communication? What do we want to say? The first step that we do at the Health Communication Research Laboratory when we're trying to develop a set of messages for a particular audience is to develop message concepts. These are pretty much just the main themes of what we would like to communicate. How do we develop these message concepts? Well, we look at the literature. We look at the lay literature, things that you can find online, things that you can find as a general consumer of information. But we also look at scientific literature as well. And what we're looking for here in particular are things that we think we can build into a message such that it will be more persuasive to the reader or the listener. So can we figure out what barriers they might have, what beliefs they have, what are the risk factors they um, presently have, or what they think are related to the adverse health outcome? What are the attitudes they have toward what particular behavior we want them to do? And what are the social norms that they believe in, that they exist around? We will take those findings and craft messages related to those topics in an effort to try to get them to do what we want to do, for example, with the COVID-19 vaccine, which is get the vaccine. And once we develop our brief messages, similar to the "you are essential" message that we saw in that example for educators, what we want to do is pretest. So we want to take these messages that we've developed and really get the target audience's opinions, reactions, experiences with that message. So there are a couple of ways that we do this. One way is cognitive response testing. So this is a more involved way of getting someone's opinion or reactions to a particular stimuli. So what we might do, for example, is show that message or that sample material for the educator that says "you are essential." And we would ask them, participants, to explain to us what they're thinking of as they read the message. We would ask them how they feel after reading the message, how they would translate that in the message that they're reading into their own words. Those are some of the examples of cognitive response testing that we would do in a pre-testing type of activity. Another way of pre-testing is we've used card sorting. So imagine the message "you are essential" on an index card, and we would also have several other index cards with other messages, and we would have the participants sort which ones they like, which ones they don't like. Then we would focus on the ones they do like, ask them why they like these, focus then on the ones that they don't like and ask them why they don't like them, and what can be done, to improve upon them. And from there, we'll be able to see a little bit more separation between certain messages that really stand out and other messages that are kind of and don't really warrant a lot more effort on our part. So pre-testing is very important. In fact, in that study that I was just talking about with the special school district, we've created and identified about 20 messages so far, and we're getting ready to start doing these pre-testing activities. And of course, during the time of COVID, where everything is virtual, it is going to be a little bit of a challenge to do some of these pre-testing activities over Zoom. But we're going to forge ahead and try to get this out, because right now it's really important that we try to get some audience feedback on these materials. So that's what we want to say. almost as important as that is, where do we want to say it? We want to identify the communication channels or the messengers for our materials. This includes, are we going to do this in person? And if so, who is going to be the messenger in person? Are we going to use mass media or the internet? And if so, which sites, or how are we going to put our messages up on there? Are we going to use other trusted sources like community health workers that they might come across in their normal visits to the doctor, if they're going to the doctor right now? I mean, inherent in all of this is identifying who is a trusted source and who is a credible source. Trusted sources are both likable and similar to oneself. A credible source is one who has that trustworthiness and is also an expert in that. So trying to identify who is the best person to communicate information about COVID, about whatever health topic that you're interested in communicating, and trying to identify how they're going to get this message to the target audience, and by which means, by which communication channels. Now, this next slide continues with the previous slide in terms of how we want to say our messages. So we talked about what do we want to say, what are the basic messages. We talked about how in terms of who's going to be the messenger or the deliverer of these messages. And then here, we want to figure out how we want to say it. So how do we frame it or set a tone for the message such that it will be most effective? The first is to appeal to positive emotions for COVID-19. These emotions that we might want to appeal to include the emotions of hope or caring for others. In particular, we don't want to incite negative emotions such as fear or shame. And we want to frame vaccination as a social norm such that it's quite normal. It's a socially accepted behavior. And we want to emphasize unity in terms of getting vaccinated for COVID. And after we've identified and shaped and pre-tested all these messages, what we want to do is select the best messages. We want to improve upon those messages that the participants in the pre-testing had suggested we do to make them better, and then pre-test again. We'll take this final set and then ask again what their opinions are, just making sure that the way that we have interpreted previous iterations of feedback is how they expected or how they envisioned the changes to be made. And then as we have developed these messages, we want to figure out what is the best way in which we'd like to present it. So this is a little different than the channels. So it's a little different than saying we want to put it on social media. We want to have, this doctor in the community present this information. This slide is really talking about how do we make this information even more meaningful. The first is present it in a way that is very accessible. So using simple graphics and videos and personal narratives or stories to shape the message, using plain language, accessible language, and again, as I had said earlier, framing vaccination as a social norm. So once we've decided the way in which we're going to do that, we're also going to have to develop a promotion plan. So kind of like how big public relations or media relations firms develop a promotion plan if they are promoting a particular product. We do the same thing for the messages that we generate in order to help change behavior or attitudes about a certain health topic. So again, we have our channels of communication. We need to identify what is the best way to reach individuals that we most want to reach. We want to make sure that they are exposed to the messages that we are presenting, and that it holds their attention, that they're interested in them, and they're motivated to process and even share this information that they might have received from our messages with other people. One way to, or one tip for this all, you might think there's a lot of different pieces here, a lot of things you have to think about and consider when developing a promotion plan. The main thing that I often see that can lead into a little bit of trouble is when messages are not consistent across all of these message strategies, across all of these message platforms, media platforms. We want to make sure that everyone who's involved is saying similar, consistent things. So now that you have a plan, what we want to do is get it out there. So one of the things that we'd like to do is have either a program launch or a kickoff event. You can put on your media relations or PR firm hats and think about how to get media coverage at your event, promotional materials, getting partners involved, community partners, meaningful, trusted partners. The timing is really important, and the logistics of that communication is also important to consider. And how might the timing of your communication be enhanced so that there's really a lot of ability to pay attention to and become interested in your message? Or is the timing a little bit off such that there are so many competing or other messages that are out there regarding that topic that you want to get ahead of all of that and start your activities earlier than what others are planning on doing. And then the last piece, media kits. The CDC has actually created several media kits available for both print and online resources. And just being able to provide consistent, tested, established materials for media to be able to use when they have a story they'd like to produce is really valuable. In that sense, you're able to spread your message even further if media come to you asking for information such that they can also help distribute. So after you figure out what your plan is for getting it out there and you implement it, and your messages have been distributed, the main question you want to ask throughout that process is, how well did you do? So this slide incorporates the importance of evaluation. So being able to evaluate the process and the outcome of the activities that you had produced and implemented. So remember that first slide, or one of the first slides, about creating SMART objectives? Well, this is where it's really important to have SMART objectives, because then we can link back to them and see how well we met those objectives or not. And so in doing so, we can also try to help understand what pieces are working, what pieces aren't working. we found already with COVID-19 communication, and in particular about the vaccine, that there is rampant misinformation. So it requires an additional level of understanding and monitoring for cases of misinformation, such that we want to be able to respond quickly to cases of misinformation when it's appropriate, so that myths can stay myths, or myths can be debunked. And then what you'd like to do after you've established effectiveness for your health communication program is to demonstrate the value of this to any interested parties. So if it worked in one setting here in St. Louis, could it also work for another place in Memphis? Or could it work for a different type of population? So if it worked for schools, would it work for work sites? And so in doing so, you would first have to identify how and when you would expect change to occur, how you would capture the scope of change and what data you might be able to collect. And again, quantitative and qualitative data are important, especially for outcome evaluations. They're really looking for some quantitative data to help assess progress, but I don't want to undersell the importance of qualitative data as well. So we have here the trade-off triangle, or the triple constraint theory. Some of you might have heard this before. But in creating health communication materials and creating health communication messages, I tell my students, this triangle is real. So you can get any two of these three in the triangle, but you can't get all three, or it's going to be really challenging to get all three. And so here's some examples. If I got something that was really good and I was able to get this communication plan fast, it'll come at a price. It won't be cheap, right? Or if I could get something that was both fast and cheap, it might not be good. They might not have had the opportunity to do a lot of pre-testing with members of the target audience. So if they didn't, you're kind of gambling with whether or not it's going to be really good or really effective, right? And then last, you could have something that was cheap and it was good, but it's not going to be fast. So continuing with the previous example, it may be cheap and it may be good because you're doing a lot of pre-testing, but it's going to take some time because you don't have the types of resources to be able to make it go that fast. So I encourage you to think about how the trade-off triangle can affect the way that we're able to deal with communications regarding COVID-19. Now, there are different ways in which we could improve upon communication. Now, these are, starting with this slide, I'm going to show a couple of methods that we've used at the Health Communication Research Laboratory to improve communication among several different sets of audiences. Not necessarily related to COVID-19, but still very relevant to communication about COVID. So one of the things I had talked about earlier in terms of presenting clear language in appealing formats is the use of stories or narratives. An example of how we've done this in the past was we were working on a project trying to encourage African-American women to get regular mammograms. And so the way that we had done that was we videotaped and interviewed 50 African-American breast cancer survivors, where they're sharing their stories about their breast cancer process, from when they were screened to when they were diagnosed and through the treatment, and then now through survival. And we created a DVD and delivered the DVD to a set of participants, research participants in our study, where we compared the difference of receiving these DVDs versus receiving a just kind of a didactic set of information that's standard based on the National Cancer Institute information that they provide. And we found a significant difference in the intention of women who intended to get a mammogram in the next 2 years based on which group they were in. And the story, those receiving the stories and the narratives were much more likely to intend to get a mammogram. A second way to improve your written communication is to use visuals. And so, for example, the set of four icons you see on the left, that's from the CDC's website. Those are some visuals they have regarding COVID-19. So very simple, simple colors, simple accompanying messages along with the visuals. The graphic here on the right is not for COVID-19 specifically, but it's for a certain drug, a certain therapeutic, but trying to explain what the chance of the side effect is and trying to measure what and relate that side effect to severity. So for example, this big yellow dot here in the lower right says 30% nausea. So 30%, there's a 30% chance that if you're taking this therapeutic that you may experience a side effect of nausea. But you'll see that it's further down on this chart because it's not as severe of a side effect as perhaps this one up here at the top, which is a severe skin disorder, but it's also a very rare chance of this side effect. So you could imagine that perhaps some kind of graphic like this could be developed for the COVID-19 vaccines and the chances of side effects and the severity of those side effects. And I would guess it would be very similar to this one based on the literature that I've seen so far. Another way to help improve written communication is to use headings to help readers scan and find the information that they need very quickly. This is also from the CDC website, and you'll see that this heading is what to expect after getting a COVID-19 vaccine. And you'll see that these blue headings, there are 3 that I show here: common side effects, helpful tips, and when to call the doctor, are ways in which if you're a reader and you just want to find out what are the side effects that I might expect, you would go to that section. Or when to call the doctor, and you would be able to better and more quickly find that information if you use headings to help organize the material such that readers would be able to find it much easier. Now, this next slide is something that, well, you might not be able to read or understand these words, and this is called Greeking It In by those who are involved in graphic design and layout. And so if they don't have the exact text that they need to be able to produce a layout or a design layout, they'll use these words. They call it Greeking It In, just to pretend like there are words on the page so that they can see how it looks. So we also do that here to not get you involved in understanding what the words actually mean, but looking at the way that it looks on the page. And so on the left, the box on the left, you see this set of words, and the exact same set of words are in the box to the right. And improving written communication by using chunking helps to provide an easier way of understanding and recalling the information that you read. So like I said, the words on the left are the same as the words on the right, but you'll see on the right that we've created a little bit of space. We have a little, some paragraphs in between those words, those lines. And in doing so, we provide a way for your eyes to rest and be able to pause and get that information that you've just read kind of cemented in your brain before you move on to the next section. Whereas you would not have that ability to rest in the box on the left, such that comprehension and recall may be worse in the left compared to the right. So don't be afraid of having white space, of breaking up your words so that they're in little bite-sized pieces or little chunks. Another way to improve written communication is to explain numbers and risk. There's a whole area of research called numeracy, revolving around numeracy. And that's where researchers are looking at the best way to explain the numbers, explain risk, personal risk, overall risk. And what we want to do when we come up with numbers is try to anticipate what readers might read into. We want to assess whether or not they'll have emotional reactions to this information and how it might affect their comprehension or their understanding and future decision making. So here is a sample of a graphic that tries to assess or to present risk using numbers. So this is from a project where the individual is a smoker, and we're looking at risk of other chronic diseases due to the smoking. And so this is the individual score, so 53 because this person smokes. And you'll also see on this bar at the bottom that U is pointed out here around the middle. And this is extreme risk and this is low risk. So as you move up the bar toward the right, your risk decreases. So on average, the risk of anyone getting a chronic disease is 63, but yours is lower than that because you smoke. But if you quit smoking, your risk could in fact get to be higher than the average score. Now that's a lot to take in, but this is one way in which one group has tried to compare and present relative numbers compared to another set. Here, there's, this is from a publication that was talking about the risk of getting COVID based on prevention measures like wearing a face mask and ventilation, and also relating to the amount of time spent in the same room. And so here you have patient 0 who is tested positive, and after 4 measures of no face masks or no ventilation, and all of the other people in the room have a high chance of also contracting COVID. But when face masks are used, you reduce that slightly, but it's still the amount of time and the aerosols that still contribute to the risk. And so with reducing the time by by half by increasing the ventilation and air and everyone wearing face masks. Only one person then is identified as a potential spread. So another piece is to design for improved comprehension among those who have limited health literacy. We haven't talked about this as much, except in the sense that we want to use accessible language. And this is really important, especially if you're developing messages for a broad population, and then also for certain underserved populations that may have more limited health literacy. So in order to do that, there's some techniques you can use. First is to present the most important information first and by itself. So present that first, have some white space around, and then continue with the rest of your messages. In terms of presenting numbers, indicate that the higher number rather than the lower number is the better number or better quality. It's always important to use the same denominators to present risk and treatment benefit. Like we've seen with some previous slides, having icons to accompany either text or numerical presentations, and then adding video or stories also helps with written communication among limited health literacy populations. And some other plain language tips is organizing again to serve the audience, making sure that the most important but the most interesting things to the audience are presented first. Again, with our earlier slides, really knowing your audience and the reason, your purpose and your objectives before you begin. And then presenting all the information as you go on in terms of order of importance to the audience. You want to choose your words carefully, writing in the active as opposed to the passive voice. You want to keep your sentences and paragraphs short and not use jargon. You want to use words and numbers that your audience knows. For example, when the stay-at-home orders first came out, the term social distancing came out. Well, what was social distancing? I would argue that term was not a regular term. That wasn't a term that everyone knew. And perhaps there could have been a better term that was used to make it more plain language and accessible. It's fine when you're doing plain language, when you're trying to create materials that have more plain language, to use you and other pronouns. Making information easy to find with headings and text boxes, and deleting anything that's not needed, and creating lists and tables. So that's wrapping up health communication. I just wanted to briefly run through risk communication as well. And because this is an infectious disease that we're dealing with COVID, the CDC especially has an obligation to communicate what they know about the risk to the audience that it serves. And so risk communication is used to communicate with those who are at risk during an emergency or disaster. We want to make sure that the best possible decisions can be made in order to help protect people and prevent spread of disease. And so in order to communicate about the risks to the public health, there are lots of different times in which risk communication might happen. So for example, COVID, an infectious disease control. We saw previously to COVID, we saw SARS, we saw MERS, we saw Ebola. All of that information had to be communicated because it was a communicable disease. There are other times in which we need to communicate about risks to public health, including if there are pollutants, in our water supplies or in our air, other types of food or medicine safety that's being monitored by the FDA, other times where there are disasters due to hurricanes, flooding, tornadoes, and how to get resources and assistance. And then there are also work-related and lifestyle risks for which we'll need to communicate about these risks. And just knowing that there are sides to communicating about this. It's often stereotyped that the public, the general public, ignores sensible and scientifically sound advice, whereas those who are, quote, in charge are potentially untrustworthy, secretive, and prone to nanny. They're telling us what to do. So you can see that these could be two sides that happen in risk communication. And the World Health Organization has identified ways in which risk communication can be done most effectively. And they provide three tips for that. One is to build trust and engage with the affected populations. The second is to integrate this communication into the health and emergency response systems. And the third is to actually practice emergency risk communication and not just have to start doing it when there is a risk that emerges. And so with the first, building trust and engaging with affected populations, this is where you'll want to have all of this information. You want to be transparent. You want to link to other services, easy to understand. You want to disseminate it broadly, explicitly address uncertainty. Tell people when you don't know, say you don't know when you don't know, and then identify who those trusted people are and involve them in the decision-making process. In terms of the second bullet, integrating emergency risk communication into response systems. So making sure that you identify, build, and provide resources toward having emergency risk communication as part of an overall public response system. And then this also can be done with strategic planning and continued research, and also with the use of social media. So using social media as a strategy to help engage the public, facilitate communication, and try to respond to misinformation and other concerns, and initiate and facilitate responses. And lastly, with that, having messaging that is not explained in technical terms, using consistent messages, and promoting a specific action or behavior that people can take. So with that, some overall don'ts for communicating about COVID-19 vaccination. So this is taken from the tips from the National Institutes of Health. I've said to this time mostly things that you should do, and then I wanted to add just at the very end some things you shouldn't do. Just remember that it is going to be better if you don't use judgmental language. It's going to be better if you don't suggest that vaccination is a requirement or a mandate. You shouldn't try to overwhelm people with complicated math, statistics, or scientific explanations. You also don't want to set unrealistic expectations about the availability of the vaccine. As we've seen, it's been really hard to find the vaccine right now, but folks say that that is going to improve. We've also seen how folks like Dr. Fauci have been careful not to exaggerate how the vaccine could instantly end the pandemic. Messaging has been out there already about saying, even if you get the vaccine, we're still going to have to be exercising those preventive behaviors like wearing masks, social distancing, etc. Don't repeat the same message in the same way. So this is different though than consistency. You just don't want the message to be said the same exact way, the same exact, in the same exact places, such that the people you're trying to reach get immune to it. So you can still be consistent with a message, but not have the same exact message each time. Does that make sense? And then last, they say, don't politicize vaccination. I think those are all good tips for communicating about the vaccine. And in summary, after all of this, the field of health communication and the research and practice efforts that we do in this area can help answer why a problem exists, whom to select to deliver this message. It identifies what you need to know about the audience before you take action or deliver a message. Says how you can reach people and make an impact, and which strategies are going to be most likely to influence or cause change. So there is a science to this, and it can be tested and evaluated. And with that, I'd like to take any questions. I know that Krista has been compiling them. If you would like more information about any of the slides that I provided, please don't hesitate to contact me. I will also put in a little plug. We're always looking for students to help us at the Health Communication Research Lab for our COVID-19 related projects, but any other health communication related projects that we also have going on right now too. So please don't hesitate to reach me or look at our website for some of the recent projects that we're doing. So thank you very much.
Wonderful. Thank you so much. That was great. So the students have a lot of questions. I've tried to pull them together into some different groups, but many of the students were saying, thank you, this was a really helpful presentation. So from them and me, thank you very much. What I want to start with is students are trying to get a better understanding. I mean, what you showed is a very in-depth process that goes into health messaging. And so they're wondering, on average, how long does that process usually take? And because of COVID, has there for the past year been a need to speed up that process? And if so, how has that then impacted the messages that we're getting?
Right. Great questions, everyone. And there's probably about 3 different questions in there, so I'll try to answer them all. And Krista, please keep me on track if I didn't get to any of those sub-questions. First, it depends on what you're trying to communicate about. If there's a lot of information out there already, a lot of research that's been done on a particular topic, a lot of papers that are out there explaining what the barriers are, what beliefs and attitudes people have about a certain topic, it's going to be a lot easier and a lot simpler to create messages that address those. We're here with COVID. It came so fast. And as you might recall, about a year ago, we just didn't know very much about it. I mean, even as we were entering the summer, we were still learning about things that mattered or didn't matter so much. So that really does make things challenging. I will say that I thought that the CDC really pulled it together and got some materials created very quickly. I would say in general that I thought that the messages were written in plain language and had the most important messages and action steps there. Could more have been done to make it really tailored to certain audiences? I think yes, but at that time, like I said, there wasn't a lot of information out there. So now with the vaccine, we've had some time to see how people's reactions toward the vaccine have been. We're also finding that in certain populations, misinformation is even more rampant. For example, I just read an article that said that in immigrant Mexican in Mexican immigrant populations, misinformation is being spread so much faster because materials that try to combat that misinformation have not been adequately translated to all languages. And so there's that disconnect. So people are trying to really create materials quickly, but it's also hard to compete with social media and the way that the 24/7 news hour where things are just constantly evolving. That said, I think if you have the resources and you have the skills to be able to create messages, I mean, PR firms do it very quickly. It just depends on resources and that triangle that I was telling you about. You could do something good, cheap, or fast, and you can only get 2 of the 3. So you'll just have to determine what's the most important for you.
Yep, that's great.
Did I answer all the questions?
Yes, you did. And you touched on something that a lot of people had questions about, which is how do you combat misinformation? And students are wondering, is that something that should be done directly, or really should you just focus on reiterating the information that is correct? And I do want to point out here, the students, I think I mentioned to you, have assignments where they're sharing the information that they're learning in this class. So I think one thing that I'm hearing from you maybe is that if it's that potentially there are certain messages that it's good for professionals who are trained in this to try and deal with, whereas amplifying those messages can be done, within known groups for your, known audience. You can amplify those messages, but I don't know. So I guess the one question is, who should be trying to directly deal with misinformation, or should no one directly deal with misinformation?
I think there's a time and a place for dealing with misinformation. I find it very important to deal with it, though, if possible. One way in which we've developed messages to deal with it is by doing like a myth fact kind of thing. So a myth juxtaposed with the fact. You'll often see these in magazines. You'll see these in, online quizzes and that kind of thing. But most importantly, when you're trying to debunk a myth, you want to be respectful, and you don't want to assume things about your target audience who do believe that, and very gently try to present the alternative information, the fact, such that they are more persuaded by that than the original piece of misinformation. So it's not going to do anyone any good to be combative or put someone down for believing a certain myth, that even though you might think that's completely wild and completely out there, there is a way to do it such that we don't offend anyone. That's really important to remember.
Yeah. Yes, and I loved that message that you had a few places in your talk, thinking about the language that you're using. That's something that we've talked about in this class, and being careful to not attack people or be judgmental or shame them. So I think that's wonderful. Another question that a lot of students had that you touched on a little bit in your first answer is this issue with translating information into different languages. And students were wondering if there are any states that have done that well, or specific examples you can think of that are like a good positive example of doing that well, or suggestions for how that could be done better.
That's a really, really great question. I have not looked at examples that juxtapose, certain states or certain sources. I do know that we're working right now with the Connecticut 211. 211 is an organization. It's a 3-digit exchange where if you're looking for information about anything at all, you can pick up your telephone and call 211. You'll be connected to a dispatcher, an information specialist who will try to get the information that you need. And in Connecticut, if you dial 211, you can get information on a food pantry, or you can get information on getting utility assistance, but you can also get information about COVID. And I know that all of their messages are translated into Spanish language as well. All of the information that they provide is in Spanish regarding, vaccine, regarding just regular information, testing. So in that sense, they are providing Spanish language options, but I don't know about the quality compared to other states. I'm sorry, I don't have that information.
No, that's okay. That's great. So another question that students had about your lecture is the idea of pre-testing and the importance of that. So they were wondering if you could just expand on that a little bit in terms of how many rounds of that you might need to do, and also how do you avoid confirmation bias? For example, in terms of vaccines, are the people who are participating people who want to get the vaccine already? How do you get people who don't think they should be getting any vaccines at all, let alone the COVID-19 vaccine, to be part of those groups? And are there any sort of incentives that you use to have people be part of these pre-testing groups?
Great question. So we've used pre-testing in most all of our communication research projects. The first way we try to recruit such that we are trying to avoid or minimize confirmation bias is to partner with organizations who can help identify potential participants who don't necessarily share the same opinions about things. So again, that would mean maybe trying to recruit individuals who have not been involved in research projects in the past, or who have an active distrust of people who do research, right? So that's why working and partnering with trusted organizations is really important. We've done work with local churches, for example, to identify potential participants of our program. And as someone who has helped run these pre-testing activities, I don't want someone my preference would be to have someone who is opposed to my messages, or someone who always has a way to improve them, rather than just to say, yeah, that looks great. I think, as you all know, as students, getting feedback on what you've produced helps make you better. And so if we can get as much feedback from our materials as possible from a diverse set of individuals, then that would be excellent. And in terms of the incentives, we usually provide an incentive. It's these activities are usually funded through a grant of some kind. We typically provide a $20 gift card in exchange for the time that they spend. You don't want to make that too expensive. Otherwise, you get people who really just want to, who want the incentive and not really will provide a more honest and less biased view of what you're asking them to do.
Yeah, that makes sense. Students also were wondering, in terms of this, talking to people and how to share a message with people who don't understand the science, or, don't quote unquote believe the science, people who are anti-vaxxers in their lives, like when they're talking to their friends, someone mentioned their roommate or their family member, people that they're close to, since they were saying, we know that the stats aren't necessarily what's going to convince them, or the science. Do you have any suggestions for the best approach for trying to talk about these issues with those groups?
It is a challenge. I mean, if it wasn't a challenge, everything would be so much easier right now, and everyone would be getting vaccinated, right? Coming from a public health person who believes in vaccination. I think the most important thing to do is to appeal to some kind of positive emotional component. In some of the work that we've done, really putting it into a personal story or a testimonial type of thing, where someone has lived through getting COVID, and the loss and the hardship and the pain that has come along with that, and especially if that person is a trustworthy, believable, similar, and likable source, such that the person who may be a disbeliever in it may be more swayed by their story than anything they might read on the CDC website. Having that personal connection, I think, will go along a much longer way than just reading something they see, some piece of fact or some fact that they read.
Yes. So we only have a few minutes left, but I'm hoping to get through two more questions. One, some of the students were asking about how to communicate with groups, for example, that are visually impaired, because a lot of the suggestions would have been visual messaging. And also just more generally, they were asking about people with disabilities, as they're one of the groups that has been really impacted by this pandemic. And I think a great fit for the sort of work that you do. And then paired with that, also, how do you message to different age groups? And I think for you, a good question is particularly about children. How do you message for children?
Okay, so let me take the disabled population question first. That is not my area of expertise. And so the first thing that I would do is partner with people for whom that is their area of expertise. I can come up with content, but those experts can come up with the best ways that they've found to be able to communicate and get messages out. So I don't want to underestimate how important it is to work with people who really understand the population, and to really work with people who are trusted and who have direct experience working with that population.
Great.
So whether it's transferring
children.
Oh, and then children, sorry. Thank you for reminding me. Children, it's not really that you're not really focused on the children. You're focused on the parents of those children, especially when it comes to the COVID vaccine. And in fact, the project that we're working on right now, the goal is to get more students tested, but we're really just targeting the parents of those children. So what are the concerns, the beliefs, the attitudes that those parents of the children in these schools have? How can we help answer their questions about the vaccine such that they'll feel more comfortable with it? How can we talk about the benefits of getting vaccinated in ways that will be very, very tangible for them? And so that's when you're dealing with children and youth populations, really you're dealing with their parents, because that's who would be involved. So for example, if you're trying to reduce childhood obesity, you wouldn't be working with the child to educate a 5-year-old on exercise and eating more healthy. You would be working with the parent. And so just keeping that in mind as well.
That's excellent. Okay, we are at time, but I was hoping you could just say if you have any final message for the students before we go.
Well, number one, thanks for the opportunity, Krista. I would say this field is so important. Getting the right information out to everyone about COVID-19 and the vaccine is so important right now. We are living in a case study, a public health case study. And so we need young people like you all working on this and knowing how to best reach certain segments of the population like yours to try to get behavior change and attitude change through. So there are ways in which you can continue your learning through graduate studies or what have you. And so I encourage you to reach out to me or look into other options if this is something that's really interesting to you.
That's wonderful. Thank you so much. I think you've given all of the students a lot of great information that they can use for their assignments, and also just for, trying to survive in this pandemic and communicate during this pandemic. So thank you very much. We really appreciate it.
No problem. Stay warm, stay safe.
Yeah, thank you. Yes. So for the rest of you, we will see you again on Wednesday. Until then, stay safe.